Exoderil Cream belongs to the group of dermatological medications and is available in 50-gram aluminum tubes. The active ingredient of the cream is Naftifine Hydrochloride. You can find the list of inactive ingredients at the end of this video. The information in this video has been prepared based on the official leaflet to inform Exoderil users. If this video is helpful to you, don't forget to like, subscribe, and turn on the notification bell for support. What is Exoderil Cream used for? Exoderil Cream is used in the treatment of fungal skin infections. Its active ingredient, Naftifine, is an antifungal agent that disrupts the cell membrane of fungi, stopping their growth and multiplication. This cream not only kills fungi but also reduces itching, redness, and inflammation quickly. As a result, it both treats the infection and relieves the discomfort on the skin. Exoderil is used for external treatment of fungal infections on various parts of the body. The most common uses include athlete's foot, body fungus, jock itch, interdigital fungus, nail fungus, candida skin infections, and fungal infections that cause skin discoloration. How to use Exoderil Cream. This cream is usually applied once a day, preferably at night before bedtime. Here's how to use it properly. Wash the affected area with warm water and dry it thoroughly. Apply a thin layer of cream not only to the infected area, but also about 2 centimeters of surrounding healthy skin. Gently rub the cream into the skin until fully absorbed. If applied to skin folds, covering with a light gauze overnight may help. In case of nail fungus, keep nails short and rub the cream well into the nail bed. You may cover the nail with a bandage if necessary. The treatment duration varies depending on the infection type. It usually takes 2 to 4 weeks for skin infections and several months for nail infections. Even if symptoms disappear, continue using the cream for at least 2 more weeks to prevent recurrence. Precautions during treatment. Medication alone is not enough. Personal hygiene is essential. Change clothes and socks daily. Keep the affected area dry and avoid moisture. Avoid tight, non-breathable clothing. Do not share personal items like towels, slippers, or shoes. Avoid walking barefoot in public areas such as pools, saunas, and communal showers. Warnings before using Exoderil Cream. Do not use this medicine if you are allergic to Naftifine or any of the other ingredients. Exoderil is for external use only. Avoid contact with eyes, mouth, or open wounds. If severe redness, burning, or itching occurs, stop using the cream and consult your doctor. If you are pregnant or breastfeeding, use only under medical advice. There are no sufficient studies on children. Therefore, it is not recommended for pediatric use. Possible side effects of Exoderil Cream. Exoderil is generally well tolerated, but some mild side effects may occur. Common side effects include burning, stinging, or itching sensation on the skin. Less commonly, redness, irritation, or sensitivity may appear. These effects are usually mild and temporary, and treatment doesn't need to be stopped. However, if symptoms worsen, contact your doctor. If this video was helpful to you, please like the video and subscribe to the channel for support. Share your experiences and thoughts about Exoderil in the comments below. Wishing you good health.